Hi, this is Dr. Jerry Perrone in Vero Beach, Florida, and I'm here today with Mark King for a treatment of Radiesse and Sculptra. I originally treated Mark for HIV facial lipoatrophy about 10 months ago. He then had a follow-up treatment 8 months ago, and Mark had a good result. He has noted some drop-off in the correction over the last few months. What I want to accomplish today is to really try to bring him back to full correction again. During today's treatment, I'll go through some of the more technical considerations of the treatment, the molding, how we use Radiesse first and then use Sculptra on top of it, and hopefully he'll continue to have positive results. Thank you very much, and I look forward to this treatment. Did it seem exaggerated at first? Did you feel like it was a little bit over?
Yes, it did. You know, the first few days, of course, it's just swollen.
Right.
And it didn't seem exaggerated until it started to settle down.
Mm-hmm.
You know, and by that I mean a month.
Mm-hmm.
You know, a month or so went by, and then it started to really kind of just like settle.
Mm-hmm.
But during that month, I didn't feel like I looked unnatural.
Mm-hmm.
It just wasn't quite me.
Yeah.
You know, and now I feel like I've gotten my face back.
You definitely look better than when I first met you. You still have some mid-face lipoatrophy, just in this triangle region. What I see now is this little drop-off in this triangle.
Mm-hmm.
And really the same on the other side.
The only thing that I've noticed since we did it the first time is there seems to be this ridge right here. You know, almost as if there was an injection right here that kind of just stayed. I don't know if maybe I didn't rub it in enough when it first happened.
It's very common with Radiesse and Sculptra injections to get contour irregularities where you can feel them or you can see them. One of the nice things about doing these treatments is with the follow-up iterations, when you're retreating, you can blend in the edges of these contour irregularities. So you may still treat in this area, but you would just treat below it as well in this area to give it a smoother appearance. Now, the other thing we talked about last time, Mark, was jawline. As men age, women too, we tend to lose our jawline. So often, just in this area, by putting some filler in, it actually, it doesn't really lift, but it does, by adding some volume here, it kind of restores that jawline. The areas I see, the triangles from lipoatrophy, some scarring down here, a little bit of volume loss, and in this ridge, softening that ridge and making the contour more irregular. Bringing out the jawline here and tightening this up and filling this in here. Even if someone has a jowl, you can actually camouflage it with that technique, and you're not even there yet. Wow. So, find this ridge and deep breath. Usually the first injection is the touchiest. Seems like more of your atrophy is on the right, a little bit more. So I'll actually use a little more product on the right compared to the left. That's it. Now I'm just going to do some molding.
Okay. Sometimes when I am massaging, you know, 5 minutes a day, 5 times a day, I'm wondering if I'm massaging too tough. Is it possible that I can displace the Radiesse the second day, or should I not be worried about that?
Shouldn't be worried, but I wouldn't massage overly aggressively either. You know, the right pressure is with your thumb, about what I'm doing right now.
Okay.
Kind of moderate pressure.
Okay.
You have a little bit of kind of vascular congestion. You know, there's reddishness and whitishness in this area, and we see that in some people.
Is that just my sensitive skin?
I think it's two things. I think your skin is sensitive, and some people, for whatever reason, just have kind of superficial, right under the skin, vascular congestion in response to fillers. What I'm going to ask you to do after this treatment is to take a preventative antibiotic. This nasolabial fold, although it's not prominent, you actually, when you do animate your face, you do see it a little bit. Yep, so I'm going to treat that. There's a little bit of old scarring. I'm also going to treat down here because you have a little more scarring here. Technique that I'm using is called a tunneling technique, and really through that same puncture site I'm able to fill this entire right cheek area. Just now, most of this triangle has been corrected just through one puncture.
Really, just like that?
And now I'll do the border zones in here, over here, and over here. Radiesse has a durability 9 months to 12 months plus or minus. And Sculptra 2 to 3 years, it looks like.
Really?
We're doing that. We're in the little past the halfway point in a 5-year study of Sculptra, and I would say between year 1 and year 2, people are very similar. A little bit of a drop off between year 2 and year 3, as a general statement. Immediately after it's done, Radiesse can often appear lumpy, bumpy. And I think last time you had that too. Like if you look over here, you see here's the implant, and the edges are. It's kind of, the contour is not completely flat, and a lot of that is the body's. It's a tissue reaction to the filler. That fades in a day or two. We made it halfway through the treatment. We've done the first part, which is Radiesse, and we've really targeted these mid areas, and on the right side down here, partly because of some scarring. And now I'm going to use Sculptra. What I'm going to plan to do with Sculptra is treat these same areas. The idea being that overlaying Sculptra on top of Radiesse, as Radiesse goes away, Sculptra will be working in here, which is really your main area of concern. And I'll also do a little bit of the edges too, just to get a smooth contour coming in. A little bit here and here as well. And if we have enough, just a little bit of jawline enhancement. This way you can see if you like that and go from there. Okay, so really what we've achieved here is increased fullness in this area, overdone, clearly, and you can see this kind of band up here, and what that band represents is Sculptra on top of, beneath, and above the that little bit of nodularity that was here. And then we filled this mid-face area, a little bit of Sculptra in the jawline. And again, that doesn't typically work right away, but over time that would be an area for the future, and then a little bit over here. Now we're going to get some ice for you, put ice on this area, and then I'll let you see. And just so you realize, after treatment, this is not a normal appearance. You're kind of puffy, you almost look like a Star Wars creation for 24 hours. So this acute swelling goes down pretty quickly. But in general, you can see what we did. This area that was depressed before is now up. A little bit here just to treat these areas. And in the beginning, we're trying to bring a sharper jawline by giving some volume over here.
Okay. Hey, I like the look of that jawline.
Okay, very good. Okay, thanks, Mark.
Well, it has been about 8 weeks since I had the procedure. The shots aren't great. I mean, they are uncomfortable, but I got through that fine, and actually I feel as if my face probably looks about what it would have looked like had I never had the facial wasting. And I'm very happy about that. So I would consider it a success, and I'm glad that I did it. And I hope this gives you a pretty good look at how it's looking 2 months after that third visit.